All right, start again.
Okay, so today I'm here again. Good evening, everyone. So we talk about the second part of abdominal pain. Is it how to approach a patient with the complaint of abdominal pain? So like we said last time, abdominal pain is one of the most common complaint that for your visit at either the hospital or either in the clinic. So it can be a very from a benign to most of the time a benign in a cell limited condition to a very dangerous or can be fatal. Um, and then, like we said last time, it's very challenging to get information and to make a diagnosis, especially for little kids. And then another thing with pediatric is not like adults, the different age have different problems, different age have different diseases. So then they require different diagnostic tools and then different way to talk to them, to have the effective communication and collaboration too. So it should go quickly through this. So like I said before, so like every age have different diseases that can happen to them. So the way we approach it, the way we talk, tailor, have to tailor, based on that matters. So let's say for infants, so we don't know if they really having abdominal pain or not. So we would have to ask him, indirectly. So is it how has your baby been, inconsolable or drawing their legs toward their abdomen, or have you noticed any episodes of pulling legs of abdomen, inconsolable crying? Because they cry nonstop. We cannot, make them stop crying. Or have your child cast any red jelly like stool, like blood in the stool? Or you observe any episodes of vomiting, really bowel-like or greenish content? So a lot of time I ask the parent, like, you see, is it episodic crying, like they cry and they stop for no reason? So we have to consider this. And then for other lesson, we can ask them directly. So the way you can look into the example. I'm gonna go quick for this one. We're not gonna stay long for this. So this is the example of the diseases or condition that can happen to children based on their age. As you can see, from birth to 1 year, they have different diseases can happen to them, like or 2 to 5 year, they have different can like diseases can happen to them, and then 6 to 11, they have different group of conditions. So that we have to put in mind because we have to tailor the encounter based on this. So we may ask about more about a colic, about a constipation and stuff for little kid, or wobblers or Hirschsprung on those things, or interoception. But like for school age kid, we asking more about like gastroenteritis and UTI, like urinary tract infection, or even pharyngitis can cause abdominal pain too. So actually, I have a kid with the strep throat today coming for a fever and abdominal pain and vomiting. It turned out to be a strep pharyngitis. So, and then they can be have a lot of stuff and mesenteric lymphadenitis, those things. So we have to consider that too. So based on what we have, based on the information we have or the examination we do, what we gather from that, and then we're gonna consider using the appropriate diagnostic tools. So we try to minimize the tests we have to do as much as possible and minimize the radiation exposure for the kids. So we're gonna have to really look into what we need to do or what we don't have to do. So I'm gonna go quick through this one. So usually the one what I want to talking about is the imaging study like X-ray, KUB, ultrasound, CT scan, MRI, those things. So we always asking them before we decide to do what, to do those tests, like something like, have you ever had any previous abdominal surgery or condition? Are there any other allergy to contrast agent or iodine? Or are there any concern of radiation exposure or observe any abnormal swelling or bulging on the groin area to decide to do, what to do with them? So, and another thing that when we talk about the condition or the diagnosis that the patient might have, we have to try to say in our own words, or like the layover term, like, and then, or asking about a condition the way that, it's easy to communicate, understandable for each party, for both, both sides. So we try to, make it simple, especially for the kids to understand it. And then, talk to them in a very down to earth way, not too much with like scientific, term or medical term, and try to, make them, simple though. So let me see. So when we discuss about finding a possible diagnosis with the patient, and then a lot of time we're gonna need to reassure or need to explain to them what's going on. So especially for the kids, like let's say you think, okay, if your child's symptom and examination finding to check the possible diagnosis of appendicitis. So a lot of time you're gonna have to explain them what appendicitis is. It's the inflammation of the little, part of the intestine or the gut of that part, and then what it can happen if you don't treat it. And then, they will have a lot of questions, especially the children. The children, you think you only talk to the parent, but actually the children is there. A lot of times, like if you don't talk to them, they get so scared, they keep crying, they get, really freak out, like they don't know what's going on. What are they gonna do to me? Are they gonna cut me out, and then, like do something? So you have to talk to both of them, like parents and children as well, about a diagnosis and about what's your plan. So when you talk about a managed plan, so we talk about the what we're gonna do with the children. So always, try to communicate with them more about the treatment plan you have. So let's say for appendicitis, we recommend a surgical intervention. So usually I'm gonna explain very briefly to them what we're gonna do. So and then we're gonna put in the hospital and put in IV fluid, prepare for the operation and put in you not eating for a few hours, and I'm gonna, gonna go in there and then try to cut that part and go home and and then we're gonna make sure that everything okay. You go home in a few days, or try to talk to them, especially for the kids about what we're gonna do. So and then sometimes we have to talk about the non-surgical option of the potential benefits and risks. So there's a lot of reassurance can be there. Let's say if you have a kid with the umbilical hernia, and then say, oh, this doesn't need any surgery for now. So we're gonna observe it for about up to like 4 years, 5-year-old. If they don't have any, if the umbilical hernia doesn't close and it's still there or get bigger, and we consider, like operation and stuff like that. So, and then to wrapping it up, we're gonna have to talk about how to follow up the patient and monitoring progress. Like when we're gonna see the patient and follow up in 1 week, or to reassess the child condition, or or how the patient responds to the treatment. And then you ask them about have any concern or question about the following the process. Most of the time, you're gonna have to tell them what to watch or when they need to come back, earlier. And then, like, let's say if you see a kid with gastroenteritis, they here for fever, abdominal pain, vomiting, diarrhea. So we're gonna have to talk about, what you diagnose the patient with, like gastroenteritis. It's like usually it's like a stomach bug, like we call stomach flu. So for them to easy to understand, like you have a flu in the belly to make you fever and vomiting, diarrhea. You have to hydration a lot. You have to make sure you you drink Pedialyte, and then give them the diet, advice, and we'll have to tell them when they need to come back. So, tell them, like you need to come back when you have high fever 103, 104, or he vomiting a lot, the patient vomiting a lot, cannot keep anything down, or the patient have like so many times of diarrhea, or diarrhea with blood in there, or vomiting with blood, or the patient have a lot of pain in the belly, have more, or like inconsolable, like the patient cannot calm down with that. So, and then we have to, make sure that the patient follow through with that. They know what to do, and they know what to watch, and they know when to come back. Just that's the part, like, and then when they need to come back, right away, or like when they need to go to the ER, or go to or they need to call the 911. So do you think you have to discuss with the patient before you wrapping up the encounter, and then like they can go home or they can leave the hospital? And then another part of the pediatric abdominal pain encounter is a lot of times you have to, we call, refer to the specialist. So to refer to the specialist, so you have to talk to them why you need to refer, and then what they planning to do, and then the benefit of referral. So, or if you refer to surgeon, you have to kind of explain to them what you see and how do you how do you refer, and then how to referral gonna take place, and proceed with that. So basically, with the abdominal pain encounter, so we try to gather information and make a good diagnosis, especially the age, like specific diagnosis, and then try to use the appropriate diagnostic tools, and then use a very good, effective communication and collaboration. So make sure that we have the good understanding between the doctor and the patient, and then the parents, and have a patient-centered approach in managing the abdominal pain in pediatric population. So this is the common test we usually use. So for you guys to get familiar with the term. So usually we see the complete blood count, CBC, for to check with all the lights of the blood cell count, and then site infection information and stuff like that. So, and then urine analysis, we usually do that a lot. And then we do the urine culture, ID the bacterial, and then sensitivity. And then sometimes we need to do the stool examination, usually we check for a co-plus, parasite. We usually use OMP, it's the ovoid parasites. And you do stool culture for Arabic and anaerobic, and check the leukocyte in there. Another thing we usually do in the blood test is the CRP, is C-reactive protein, and the ESR to check for the it's an indicator of the inflammation of the body. So some tests we usually use the liver function test, the LFTs, to check the liver enzyme, and then check with the liver for the hepatitis. Another test we usually do is the CMP, the stand for complete metabolic panel. Check electrolyte, liver, kidney function, glucose, calcium, protein, etc. And sometimes we check for amylase and lipase. Usually the test we check for pancreatitis, and then imaging, we usually do abdominal ultrasound, we do abdominal X-ray. Sometimes we use the word the KUB, which is stand for kidney, urine, and bladder. So to talk about abdominal X-ray, and sometimes we do the CT scan with our contrast to check a better images of the abdomen. So today, as for Helen suggestion, I'm gonna introduce you guys with what we call the HAS question. This HAS question is we call the reviews of system for adolescent. Usually they have only one E and two S. So, but later on, people add the little E in here and another extra S in here stand for eating and safety. So usually the HAT stands for you're asking about home for age, you're asking about education, employment for E, eating for the second E, and activity employment for A. D, you're asking for drug or alcohol. S is the suicidality or depression. This is very, very important because nowadays children is very prone, very vulnerable to depression. And as far as I know, have you ever heard any shooting happen in Dallas area of like like a month ago that killed I think 9 people in the mall, and then after that we have so many kids coming for PTSD, depression, suicidal and stuff like that because of that. So then the X is another X is because asking about sexual activity, and the last one is talking about safety. So, for example, give you some example for like question about home, like where you live, how long you live there, who live with you, or do you have any pets, feel safe at home, feel safe in neighborhood, and another any gun or weapon at home. This is a very sometimes very important question to ask, especially for adolescents, because adolescents tend to mess with guns and they may cause a lot of accidents. They shoot themselves, die, or they shoot their friend, or that happen all the time. So usually we ask them too. This is an example about education question. How they do in school, you like the school or not, you feel safe at school, you're talking about bully, and then what do they like and how do they grade, and then do you have an IEP? IEP is an individual education plan, usually used for kids with special needs like ADHD or autism or intellectual disability. We don't use the retardation anymore. We use intellectual disability. It's a fancy name, but it is the same anyway. And then asking about something, their hobby, what they do after school. This is some example about activity, employment question. So, what their hobby, what they do for fun, and do any club or team. Usually the school here, they have several clubs or team, like you can join for sport or for different activities. And then some people some kids working very early here, and then talking about their work and how do they driving, talk about drive safety and then exercise, and then their weight, their eating habit. So you don't have to ask all of the questions, but usually ask it 1 or 2 questions to go through with them quickly. And then if they have problems, you're going to dig in more and ask more about it. Drug, one of the things you're going to have to ask about is drug for teenager. It's a very relevant problem right now today. So usually for this question with drug, we should start with their friends first. Don't ask directly to them first. It's like, oh, do you know anybody? Any of your friends smoke or drink? And then anyone smoke or drink at your school? And then if they say yes, and then you're gonna start to ask about it. Then have you ever tried, or have you ever used other drug or cocaine or weed or methamphetamine or ecstasy, heroin, those things. And then you talk about that, you ask him more. This is another question we usually in the clinic. We use in the clinic to ask about, adolescent safety. So we call it a crab question. The crab question, you're talking about driving, because children in US, they drive about 16-year-old, they start to drive. So, talking about how they drive, and then do they drive when they're drinking or using drugs, or they use anything to relax, or they use, drinking alcohol by themselves or alone, or do you forget things you did while you use alcohol or drug, and any friends or family ever tell you they should cut down your drinking and drug use and you get in trouble while you using alcohol or drug? Actually, this is a template we ask every case and at the clinic when they come for a physical, which is a yearly checkup. Then this is the example, suicidality question, asking about have you been feeling any sadness, or if they talk about hurting and cutting themselves, and have you ever run away from home? Have you ever cut yourself intentionally? When you see a kid coming to the clinic, when they wear the sweater with the long sleeve, shirts, which is to the heart, and then you may, have to check their wrist, and most of the time they cut, around the wrist, and then they try to cover it. And we actually do the PSQ-9 for screening for depression in the clinic too, like starting from 12 years old. So we do it yearly. So a lot of time we pick up from there too. So this is about sex question. And then talking about, do you have a boyfriend, a girlfriend, and do you have sex? Are you sexually active? And then if they say yes, and a lot of times we fit this, we try to ask. We ask without a parent, if you can. But so this is that's it. So I try to make it quick this time. Can let her make it so fast, so long. So have you guys have any question about this part?
Okay, so seems like nobody have any questions yet. I know there's a lot. Seems like there's a lot to ask, and I don't know how often we ask those questions in Vietnam. So it's gonna be a challenge to start asking those questions, especially when you face a patient. But then you got to practice. Otherwise, you will never do it. Try to practice in class first, and then hopefully one day when you see a patient, try to see if you can comfortable ask those questions in Vietnamese, and just start step by step.
Yeah, I'd like to make just a small comment about working with adolescents. So in the script that we sent out, I made a fun fact about adolescent medicine. In some programs, in some hospitals, we actually call that department, that division, adolescent and young adult medicine. It's a 3-year fellowship. So if you think about cardiology is a 3-year fellowship, adolescent medicine is a 3-year fellowship. Imagine all the science and the medicine and the research and literature that is required to be learned. We think, oh, adolescents, what's the big deal, right? What's, simple questions. They're just older children or young adults. There's the entire body of evidence and literature to be learned about adolescent that I think I wanted to give some props to my colleagues who do this work. It's a 3-year fellowship.
Yeah, I agree. Adolescent is very tough. I have a friend who is a neonatologist. I asked her why don't become a neonatologist. She said because she don't want to deal with adolescents.
Perfect.
We actually it's so hard now today with all the media, social media, and other stuff. So kids get so much with depression and sexual activity, drug use, and all of those things. So it's actually very, very, very tough, for even for a pediatrician like me to deal with that. So.
Hello, sorry, hello home. Please stop sharing the screen so people can see your face.
Let me see. How I'm gonna stop share. Okay.
Yeah, that's it.
Yeah. So for today, we can take a brief minute break, but for today, we're going to have everyone move themselves into rooms again. So I just wanted to remind everyone how to move yourself into your rooms. Okay. And then just as a quick reminder, the rooms that everyone is assigned. Okay.
Yeah, pay attention to your room.
Yeah, we
remember
can just
it.
no rush. So we're just gonna take like maybe a 3-minute break while we make sure like all the TAs are here. But I just wanted to put this up to for a quick refresher in case anyone forgot their room assignments.